Patty Gibson is fulfilling a childhood dream. Along with two friends, she owns her own bookstore in Manhattan Beach. Only a closer look reveals Patty is struggling with Parkinson's disease.
Michael J. Fox announced that he had Parkinson's, and I started reading magazine articles about him and his symptoms, and I thought, I have Parkinson's. If I'm not medicated, I feel like I'm walking around in a ski boots and a ski suit. My new thing is that I can't roll over in bed. I mean, I have to like grab onto something and turn myself over.
High in the Hollywood Hills, Mark Siegel, once a powerful political consultant, a loving father and husband, now struggles to get out of bed.
Well, and it's continually getting worse. You never get better. It's a ratchet. Some days you'll be really bad, and some days you'll be a little better. But the better is never as good as it was a month ago, and the bad is a little worse than it was last time it was bad. I'm kind of losing control of my body. I feel like I'm fading away.
Frank Fenton served on the city council as city treasurer and briefly as mayor of Beverly Hills as recently as 2 years ago. Now, Parkinson's makes it difficult for Frank to speak.
When you say you have Parkinson's and they look at you and they say, he doesn't look like he has Parkinson's.
While considered a movement disorder, Parkinson's in older adults is also associated with memory loss and dementia. Frank and Judy have been married for 50 years.
You grieve. You want it to be different. You want your spouse back. And you know that's not going to happen.
Parkinson's is a progressive disorder, so by definition it does get worse with time. We hope and expect new therapies. That's what all our efforts for research are directed towards, slowing or stopping the progression of the disease.
World-renowned UCLA movement disorders expert Dr. Jeff Bronstein is pushing the frontier of Parkinson's. Driven to change the fate of his patients, it is work that could change the fate of millions.
Movement disorders, and particularly Parkinson's disease, is one of the most common neurological disorders. And Jeff Bronstein runs our program in those areas. And his work, both with patients and in terms of the research, have been extremely important to patients worldwide.
There are windows in time when most people with Parkinson's have periods of normality, where the medicine's working and you could never tell they have Parkinson's disease. And to me, that gives a hope. If we can create that for part of the day, then why can't we create it for the whole day? And that would be a home run.
The technology, scientific knowledge, and collaboration at UCLA are remarkable.
As the disease progresses, you see more and more red.
Advanced biological markers allow doctors to test new treatments and now look for the results in the brain itself. And fast-growing, transparent zebrafish that mimic Parkinson's properties in humans allow researchers here to test new drugs and doses and possible causes of the disease, 100 at a time, pushing progress forward at an unprecedented rate.
This guy is swimming a lot. He's really active. This one.
Here at UCLA, we've actually found that people exposed to high level of pesticides are at a several-fold increased risk of getting Parkinson's disease.
Dr. Bronstein and his colleagues in the Parkinson's disease program have a wide range of projects that are addressing this very issue. What is the cause of Parkinson's disease, and what strategies might we use to prevent people from getting it and to help people who already have it?
The UCLA Movement Disorders Program offers every available treatment option, the latest drugs, surgery, a variety of procedures, and lifestyle plans. A recently added donor-sponsored advocate helps patients and families navigate it all.
Fortunately, Parkinson's progresses very slowly, so that we have this opportunity to really give hope and a chance, a realistic hope and a chance to all the people with Parkinson's disease.
The mission of the Parkinson's disease program is simple: cure Parkinson's disease.
I think Dr. Bronstein is remarkable because he is so positive. He just is very calm and very reassuring, and he gives me hope.
I wish I didn't have it, but if I have to have it, I think I'm doing the best I can. I hope to see my daughters married. I hope to see my grandkids someday. I think I will.
When you feel when you walk away from a doctor and they've given you something new to try, that there's some hope that maybe this one drug will do it. I think that's what Dr. Bronstein wants to leave people with, is that if this doesn't work, we're going to come on to something else. And if that doesn't work, we're going to come on to something. He's never shutting the door.